Hi, hello guys. This is Sanket Kanchan, your very good friend from Jhansibazaar, and a big hello to all my viewers from Jhansi and Bundelkhand. Today, in my series of Jhansi Ke Amulya Ratna, which is a very important series for Jhansibazaar, as you know, we introduce all the known personalities, successful personalities of Jhansi, and this show is no different because we have such a great surgeon of Jhansi and who has been nominated for the Padam Shree Awards, presidential awards, national awards, and he's among the senior most orthopedic surgeon of Jhansi, and his name is Dr. Rakesh Tripathi. I'm very excited to meet him. So let's go straight to him and have the time which we are blessed for today. You and me with Dr. Rakesh Tripathi and hear him out on his all achievements in life. Let's go. Today, we are very fortunate to have Dr. Rakesh Tripathi from UPCHAR Hospital with us, such a senior orthopedic surgeon, which I am trying from a very long time to catch hold of, and today is a blessed day for me. So, I have here with me, and Dr. Rakesh Tripathi doesn't need any introduction as per, but obviously, it is my duty to tell everybody out here, senior most orthopedic surgeon out here in Jhansi and Bundelkhand, and we are very fortunate to talk about it, that he is the nominated for Padam Shri Awards this year by our DM, and he is with us today. So he will going to talk about the whole study which he has been awarded for and been nominated for. So we have a good chance to talk all things about that. Dr. Saab, very, very heartiest welcome to you and deepest greetings to you on the Diwali occasion.
Thank you to you, Sanket, and happy Diwali to all my
Thank you.
well-wishers, my viewers, and I wish happy Diwali to everyone.
We're very excited actually about your nomination and we are looking forward to that.
Yeah, I'm thankful to my God, actually, my parents, with the well-wishes. At least the UP government has thought of nominating me for the prestigious national award, the Padam Shree. Whether I don't get, I don't have any words, any grudges for that. But this is an honor for me that I've been nominated. I'm the second orthopedic surgeon in the history of independent India to be nominated for that.
Wow. And that too from Jhansi and Bundelkhand really means a lot.
Yeah, I'm
Not
born
only
over
for you
here.
and for us, all
I'm
of us.
born over here, brought over here, serving my own people, my own soil. Yes, it's a
Absolutely.
privilege for me.
And for the people of Jhansi and Bundelkhand, you already won the award. So let me make this very clear to you because that is we are proud of saying that. But having said that, Dr. Saab, we are very curious to understand the entire technique. What is this Rakesh remote bone transportation technique all about? How does it benefit the patient in ortho problems? And obviously, we wanted to understand from you, where did this all started from?
Yeah, Sanket, I started this thought process started in 2007. And I'm working right from that day, developing my technique, developing my instrumentation. And this is a simple thing. When the fracture of bones are there, so we normally put our rod inside by making a hole at one end of the bone and then put a nail. So what I did, that instead of crushing that bone, I utilized that bone plug and then I innovated some tubes. By the tubes I pushed it and brought it right up to the fracture site.
Okay.
And then I put the nail.
Wow.
So this thought of utilizing, which we were throwing that bone or crushing the bone, now I utilize the same bone which has a capacity of producing a new bone.
Correct.
That bone is being transported and put at the fracture site. So what I saw, what I observed in last 50 first operations, that bone is definitely being united, bone united in a shorter time, and it is a much strengthful union than without that. So I'm using this technique.
Zero incision.
Of course, that's the best part of the technique, that at the fracture site you don't have to incise. Till now the world is doing that. If you have to invest the bone at non fracture site, you have to incise it and then put the bone and close it by the sutures. And this technique doesn't require any incision at the fracture site. So I had also named it, this is bone grafting, autogenous bone grafting without any incision.
Correct.
No incision required means no infection,
No infection, zero infection. Correct.
fast union,
Fast, yeah.
and fast movement of the
Recovery.
joint. So
Absolutely.
this technique has given a very wide exposure and opened up the window to make the early union of the bone.
Wow.
And I'm
Fantastic.
thankful to all my seniors and the Indian Orthopedic Association, the World Orthopedic Association. They recognized my technique, and I'm thankful to my God that already 400 to 500 doctors of India and abroad, they have purchased my instrumentation and utilizing and using this technique to fill the bone cavity and making the early union of the bone.
Fantastic. That's a fantastic. So, Dr. Saab, this is a fantastic stuff which you have told us, and really our excitement is now hitting the roof. Now, the point is that when you prepared this entire study, presented it abroad in so many associations abroad in so many countries where you are traveling almost. So, how is the reaction of the World Orthopedic Association onto the study? There, what excitement level were they having on what did they learn out of it? And because it is difficult to take out somebody coming from such a place, such a small place in India, rural place, and presenting such a big thing, which is like creating a revolution in the industry. So obviously it's a great thing. So how was their reaction to the entire study?
Yeah, it was great. It was great because when I first spoke in 2007, I'm thankful to Dr. Lord, the senior most surgeon of the country. I was not registered in that association lectures. When I at a lunchtime I spoke to him. I'm a very junior person and I have done this thing. He was amazed. He just took me to the dais and he requested all the audience, please listen to this boy. He has done something new the world has not thought even. And I tell you, my first lecture was not prepared very well.
Right.
And then had a feeling like an dignitary.
Yes.
When I came
For
out
sure.
of the dais, the people surrounded me. They were chatting me. They were asking me
Big
what
things.
you have
Yeah,
done
definitely.
and how you do and how you thought and how I can get the instrumentation. This type of the dignitary feeling, celebratory feeling I got that day. And whenever I present my lecture, because this technique is not been done in the world anywhere.
It's not been done.
So we are the innovators of that. We are the innovators of the technique. We are the innovation of the instrumentation by the Nebula company of Gujarat.
Wow.
The owner, he came to me and asked, can I make the instruments for you? I'm thankful to that Dr. Makaria that he did for that, and I kept up developing that technique. So I have newer and new instrumentation of my technique, and already so many operations they are using that to
Such a
make
proud
it.
feeling for all of us.
I must say
Please.
that this is the technique where the surgeon has to procure the instrumentation, but the patient, the poor patient of the country, he does not have to spend a single paisa.
Okay.
No extra burden of this technique, putting the bone from the one place to another place. No money to the poor patient. This is one of the best achievement of my life, that without spending any money, I'm doing this technique.
Yes, yes, you're right. And that too with all Make in India instruments,
Of
with your
course,
and your
I'm
counterpart
inspired.
Nebula.
I'm inspired by my prime minister,
Yeah.
my chief minister,
Yeah.
by
That's
innovating and the techniques and developing in made in India, produced in India, for Indians, for abroad, of
What a
course.
great feeling. What a great proud feeling. No doubt. I mean, I'm sure the leaders of India also will recognize and understand what great contribution you have made from this. So, now what we wanted to understand and know about some past history of yours. When did all started your doctor journey, and how did this UPCHAR hospital, such a beautiful infrastructure you have created, when did this been created, and how do you want to take this forward in terms of helping people of your region?
Yes, Sanket, I was born in Babina, the village nearby 26 kilometers from Jhansi, and because of that, there was no education apart from 8th class. So I came to Jhansi. My father worked very hard to brought us up. He also served like a doctor of that villagers,
Right.
and he always inspired me to do something new. Bojo was something what you have learned and doing is different, but you
Yeah.
think somewhat different.
Correct.
So what I thought, how to make the bone more stronger, earlier, and without any complications. So this is a technique I developed like working for last 13, 14 years, and I can say I'm thankful to UP government and Indian government that they have recognized my work, and I've been nominated for this prestigious award, national award.
We are very keen to see you there. I mean, obviously, it is another thing whether you receive it or not, but in our eyes, you have already received it.
No, no, I'm so
That is
thankful for
very,
that kind of
that's very been done.
gesture.
But thank you so much, Dr. Sir, for such a kind
Thank you.
time of yours, and we really appreciate your time. Thank you.
Thank you
so
very
much.
much.